The threat. In a report published Monday, June 12, 2017, the Office of Inspector General announced that CMS paid nearly $729.4 million in Medicare EHR incentive payments to eligible professionals, EPs, who failed to meet meaningful use requirements. The review included 485,499 Medicare EHR incentive payments made to 250,470 EPs from 2011 to 2014. These errors occurred because sampled EPs did not show support for their attestations, conducted only minimal documentation reviews, which left the self-attestations of the EHR program vulnerable to abuse and misuse of federal funds. CMS must review EP incentive payments to locate those providers who unsuccessfully attested to meaningful use measures for each program year to recover the nearly $730 million in inappropriate payments. They must also review random samples of documentation submitted by EPs for self-attestations to discover where inappropriate payments were being made following the audit period. This must be done to determine which EPs did not meet meaningful use requirements and to recover the estimated $730 million. Also review a random sample of EPs' documentation supporting their self-attestations to identify inappropriate incentive payments, stated the federal agency. CMS agreed to implement targeted risk-based audits to strengthen program integrity into 2017. However, OIG determined that targeted, risk-based audits would not be enough to capture the kinds of data errors identified in the report. From OMG Report, June 12, 2017, Federal Register. How a value-based care provider avoided a draconian CMS penalty. A Florida-based cardiology practice successfully dodged an 8% CMS penalty by implementing a rigorous CMS submission review process. To avoid a harsh CMS administrative penalty, the practice retained CUHSM working in partnership with the Suncoast RHIO to audit their 2015 quality submission and successfully resubmitted it on March 13, 2017. The CUHSM/Suncoast RHIO process streamlined the submission pre-audit process, reviewing over 283 different parameters before transmission to CMS, and they did it without disrupting our doctors from patient care. CUHSM made it possible to implement an audit process that gave us confidence in our resubmission to CMS. The submission audit process was a precursor to the OIG report published Monday, June 12, 2017. Several hospital and ambulatory sites have since stated they will implement CUHSM quality audits to strengthen program integrity. CUHSM and Suncoast understands that CMS quality reporting is critical to maximizing revenues. At the same time, CUHSM reduces the impact of reporting on office workflow while increasing confidence that CMS submissions are accurate and reflect the quality of care delivered by your healthcare organization. Please visit www.cuhsm.org for more information. CUHSM.org is a CMS-approved Qualified Clinical Data Registry. Suncoast RHIO is an approved QPP and QCDR. www.suncoastrhio.com